there's a mission behind this, by the way. So we all know that there's a healthcare problem in the world, not just the United States, but globally. Everyone knows that most of the healthcare problems exist in communities of need, lower socioeconomic backgrounds or demographics. If we want to solve these problems, what we need to do is start selecting students from those areas. My guess is the majority of you are probably coming from those communities. And we need to find a way to kind of de-risk you to bring you in to the medical program. And what you're looking at here on the screen are some of the metrics that we use. So in essence, this is a master's student being compared to medical students and how they're doing in each of the courses and whether they will or will not pass the boards. And my ultimate goal is to have all of our medical students come from this pathway. We're not going to look at the MCAT. We're not looking at the GPAs. We're looking at this side of the element. Can you pass the boards? And are you going to go work in an area where we need healthcare workers? And so that's the general evolution of what actually occurred. So it's not something that just kind of came out of nowhere. It kind of took us time to develop it. Now, let's say these scores aren't where you want. They're not as good as maybe you don't get into medical school. We also have other pathways available for you to go there. And if you're in this passing range that we see here on the right, you might go into medicine, you might go into veterinary, you might go into dentistry, you might go into physical therapy or PA. But if it starts going a little bit lower than that, there are other pathways to look at. We got all the way down to device manufacturing sales, things like that. So we got a whole list of pathways that we're going to go through as we do this. The key thing to this, and it's really quite an important thing, 40% of the global GDP is related to healthcare. Almost all the jobs, the majority of jobs on this planet are related to some way for healthcare. It's not social services, it's not defense, it's healthcare. So what we're doing is we're creating an opportunity for these students, you, to come into a program to get a job, to be able to take care of your family, provide for a good life, and hopefully make it into the medical school or whatever program you would like to go do. So providing opportunities and pathways are really kind of the critical thing what we're doing.